Hello there, friends. So, if you don't know me, my name is Iz. I am a gender fluid student here at the University of Wisconsin Eau Claire. And for my final writing assignment, I was instructed to make a multimedia project using research from our class. So, what I've decided to do for that assignment is I am making a YouTube video on the stages of transitioning. So, the series is kind of meant to be a helpful and informative series for trans people, and especially young trans people who are questioning their identity, to help them kind of understand what transitioning may mean, as well as the options they might have. So, first of all, before we jump into anything, let's talk about what is transitioning. So, transitioning in its simplest terms is a process transgender individuals go through. The term transgender is defined as identifying as a gender that is different than the sex you were assigned at birth. And when a young transgender person wants to transition, there are generally kind of 4 stages of transitioning that they have outlined for them by doctors. These transitioning stages are social transitioning, puberty blockers, hormones, and finally surgeries. So, kind of an important disclaimer I would like to say is while these stages of transitioning are available options for many trans youth, not all feel the need to go through every single one of these stages in order to feel valid in their gender identity. And that is perfectly normal, as each of these stages kind of come with their own risks and benefits. And so if you or someone you know is questioning their identity, or maybe are thinking they want to transition, I do encourage you to reach out to an adult and or a doctor that you trust to discuss a plan that is right for you. So kind of with that important note out of the way, let's move into the first stage of transitioning, which is social transitioning. Now, what is social transitioning? Social transitioning is a term used to describe a variety of steps in the transitioning process. These steps are all non-medical and are oftentimes kind of the first baby steps taken when a transgender individual begins their journey. So kind of the first, step out into the world, so to speak, is coming out. And this is the process of realizing, accepting, and telling others of an individual's kind of change in gender identity. This information is it's shared typically with people they trust. It really, most people advise that it's only shared with people you trust. And along with sharing this information of your new identity, it is oftentimes shared a change in name, pronouns, kind of the way you want to be referred to as, and addressed by. And so kind of the second step after that would be changing appearance. And many individuals will start to dress in a way that more aligns with their identity after the coming out process. This would be dressing and styling the hair more masculine or feminine. And also, as a transgender individual kind of reaches the age of puberty, if they have not already, some may choose to use specialized undergarments to help their body appear closer to their preferred gender. And for trans women, this could be using something like a padded bra to give the illusion of breasts, or a practice called tucking. This is when an individual moves the penis and testicles out of sight to give the pelvis a flat appearance. It can be done using varying different methods, but the most important thing to note is that it is done safely, under the guidance of a medical professional. There are also many resources online as to how to tuck safely, and this is important because if it is done incorrectly, there are many health risks such as infections and testicular torsion, which is no fun for anybody involved. As for trans men, they may use something called a packer, which is kind of a round object placed inside the undergarments, and this is to give the illusion of external genitalia. They may also use something called a chest binder, which is a type of compression garment used to flatten the chest area. And one thing that is important to note, much like tucking, is that it is very important to do it in a safe manner. Doctors do not recommend you bind for longer than 8 hours, and if you are planning on exercising heavily while binding, that you wear a binder that is looser than your usual. And this is in order to prevent various kind of health issues, such as chest pain, and difficulty breathing, as well as other just respiratory and musculoskeletal issues. And kind of a final step in social transitioning is kind of a change in social behavior. And this could be aligning yourself with certain activities and social groups and gatherings, typically more associated with one identity rather than another, as well as using certain segregated spaces designated for your gender identity rather than the sex you were assigned at birth. One thing that is very important to note, though, is that unfortunately a lot of states do have laws regulating these things, such as Oklahoma. They require public school students to use the bathrooms according to their assigned sex at birth rather than their gender identity. So if this is something you maybe are considering, I would heavily recommend looking into your state's regulations. There are several websites online documenting these state by state to make research on this topic easier. So kind of the next general stage of transition is the use of puberty blockers. This is kind of the first step in medical transitioning. And puberty blockers are a type of hormonal medication used to temporarily delay the effects of puberty. They were actually originally made to help delay puberty in cisgender children who maybe started puberty at an early age, and this was in order to give them more time to sort of emotionally develop, and they are used in a similar way with transgender patients. However, in this context, the age of puberty's onset isn't necessarily a deciding factor. It can be in some situations, though. So what exactly do they do? In short, they pause puberty for however long you're on them. And kind of to elaborate more, they use something called, and I'm going to have to read this out, my apologies, gonadotropin releasing hormone analogs, or GnRH for short. We will be calling them GnRH. This stops the body from releasing sex hormones, and these sex hormones are the things that cause the physical changes of puberty, both primary changes and secondary changes. So what are kind of the benefits of using puberty blockers and kind of just any other type of medical transitioning, as well as social and kind of aesthetical transitioning? For many transgender youths, the physical changes that come with puberty can cause a lot of distress. And these negative emotions towards your physical sex characteristics is referred to as gender dysphoria. And in many clinical studies, gender dysphoria has been shown to be associated with increased anxiety and depression, and by preventing the development of these characteristics, or by removing them if they've already been developed, or by helping obscure or hide them, the risk of mental health issues brought on by gender dysphoria, such as anxiety and depression, as well as the adverse effects of those, such as increased risk of self-harm and suicide, are greatly reduced. Now, like any other medical intervention, there are risks, and unfortunately, specifically when it comes to the use of puberty blockers in transgender individuals, they aren't very well known, as puberty blockers on their own are very well researched and safe medicine to take, but not much research has been done on the effects of its long-term use, especially the long-term use after the average age of puberty. Doctors have noticed a trend in decreased bone density in individuals on puberty blockers over a long term, but research does suggest that these issues could potentially be resolved by starting HRT, or hormone replacement therapy. And hormone replacement therapy is a type of medical therapy used to help the development of preferred sexual characteristics in transgender patients. It supplements naturally occurring hormones in the body, such as estrogen and testosterone, oftentimes combined with puberty blockers, in order to help a transgender patient develop characteristics aligning with their identity. Now, this process is different for everyone depending on your identity, medical history, and many other factors. Much like puberty and the puberty cisgender people go through, not everybody will develop in the same way or at the same pace. There are also several different hormones that you can be put on depending on these factors, and the two I'll be focusing on are estrogen and testosterone. So estrogen is prescribed in order to kind of feminize a patient's body. Estrogen, it kind of helps lower the amount of testosterone in the body, which is the hormone that develops male sexual characteristics. It is often paired with other medicine to help block the effects of testosterone in order to make sure the hormones are balanced, and this is in order to decrease risks of certain health complications such as cancer. It also helps aid in the developing of female sexual characteristics, and this is mainly done by redistributing body fat into a more feminine figure. In addition to this, the development of breast tissue and a change in voice could also be possible. Same goes for testosterone. Those are also things that are possible with testosterone, which is the main hormone prescribed to transmasculine patients. One of the main functions here, much like estrogen, is to block the effects of kind of the opposites. So it blocks the effects of estrogen, and it also helps develop male sexual characteristics. This is, of course, including fat redistribution, increased muscle development, increased facial hair growth, and, of course, a change in voice. Another possible effect of testosterone is something called bottom growth. And bottom growth is when the clitoris grows in width and length by a few centimeters. So the benefits of this type of therapy is similar to the benefits of puberty blockers, in the fact that it helps the individual kind of have a more natural masculine or feminine appearance, which can help decrease gender dysphoria. There we go. So some of the risks of HRT, while it once again is very well researched, does come with risks to discuss with your doctor, which vary from individual to individual, kind of depending on medical history and genetics. And some risks common amongst both of these types are weight gain, infertility, and increased risk of certain conditions such as diabetes, heart problems, and strokes. There also is a potential of increased risks of certain types of cancer. However, those risks are managed via the dosage of whatever hormone you are on. So kind of the final stage in transition that one could potentially go for is gender-affirming surgery. Now, surgery is kind of an umbrella term used to refer to several different types of procedures done to kind of surgically change the appearance of a transgender individual's body. These are typically not carried out until adulthood, just to allow the body to develop and grow to its full size, and also to allow the patient to mentally develop to a point where they can make an informed decision. These are also very high-risk procedures, as most surgeries are, and they are also the most non-reversible out of any of the options. So kind of what are the different types of surgeries? There are kind of three different types. Facial reconstruction surgery, chest surgery, also referred to as top surgery, and genital surgery, also referred to as bottom surgery. Now, facial reconstruction is a plastic surgery done to either feminize or masculinize a person's features. This can include the sharpening and softening of some features, moving the hairline to create a larger or smaller forehead, and removing or even transplanting hair follicles to get rid of or create facial hair. Pretty crazy, right? Then we get into top surgery, which is a type of surgery where there are kind of two different ones depending on whether you want more or less breast tissue. The removal of breast tissue is called a subcutaneous mastectomy, which is the removal of the breast tissue. There are several different methods depending on the patient's body. And it's kind of standard procedure through most to actually remove the nipples and aorta during the process, and then to resize and put them back on. However, in patients with smaller chests, that might not be something that needs to be done. And once again, sorry, getting lost in this. For transfeminine individuals, they can undergo a procedure called an augmentation mammoplasty. This procedure is done to enhance breast tissue. It either uses grafts of fat, artificial implants, or a combination of two, depending on the patient. Bottom surgery, by far, is the most complex out of the 3 surgeries. For transfeminine individuals, they may receive something called an orchiectomy, which is a procedure that removes the testicles, which can be done on its own or as a step towards a vaginoplasty, which is a procedure meant to create the external female genitalia. There are many different techniques to use to achieve this, some with varying results, but the most common method is to use what remains of the penis to create an aesthetical and functioning vagina. A similar procedure can be done for transmasculine individuals. It's a bit more complex. It's known as a phalloplasty, and it is a multi-stage procedure used to create a functioning phallus. The first stage is to undergo a complete hysterectomy. Prior to the phalloplasty, the skin and muscle is then grafted from a part of the body in order to construct a functioning phallus with a urinary channel. Finally, the vaginal opening is closed, and I would like to note that many of these steps actually can be done kind of on their own. They don't necessarily have to be a part of a phalloplasty. Now, some of the risks kind of throughout all of these procedures are the risk of just standard surgical risks associated with anesthesia and just procedures in general, and it's definitely something that should be discussed with your doctor. In addition to the standard risks of surgery, there also comes risks unique to these procedures, such as, because they are cosmetic procedures, scar tissue can complicate and compromise desired appearances and can also cause medical complications, specifically with bottom surgeries, as they could conflict with vital bodily systems such as the urinary tract. So I have definitely thrown a lot of information at you today, so kind of let's do a little recap. When a transgender person wants to begin the transitioning process, they have kind of 4 main steps or options that they can take throughout their journey. It is social transitioning, which involves changing one's name and appearance to better align with their identity. Puberty blockers, which halt the onset of natural puberty in order to give an individual kind of more time to explore their identity. Hormone replacement therapy, which is a therapy used to block natural hormones, and the development of natal sex characteristics in favor of their preferred sexual characteristics. And the final kind of step is surgery, which are various different procedures meant to make a transgender individual's body closely match the individual's identity by constructing both secondary and primary sexual characteristics. I really hope that you learned something today from this video. If you have any more questions regarding this video and the topics I covered here, I heavily encourage you to do your own research with a trusted adult and a doctor. If you need a place to start, all of my resources are linked down below in the description. I very much encourage you to check them out, as they have a ton of information that wasn't able to be fit in this video. So, yeah, I wish you all well on your journey, and I hope you have a good day. Bye!